For more than 3 years, I haven't been happy with my teeth. They were up and down and wavy on the top and the bottom, corroded, and all different shapes and sizes. I would always try to hide my smile in photos or in public or whatever. So I thought it was about time I had to get something done, and my wife kindly agreed to pay to give me back my smile of my youth. From the very first time I visited the Saudi-German dental department under Dr. Turk, I felt very comfortable in his presence because he explained everything, what he was going to do, the different options I have, and in the end I selected to go with the crowns as the best option. So he convinced me of that, and I'm happy with the result.
This case was not only about fixing fractured teeth. It was a comprehensive dental treatment to restore both aesthetic and function. When I saw the patient during the consultation visit, he was suffering from severe tooth wear that affects both enamel layer of the teeth and the vertical dimension of the face. And from this point, I put my treatment plan. The treatment option was to raise the bite, giving a natural smile, and restore the dentition by using zircon crowns on the upper teeth and simple composite fillings for the lowers. And after a proper healing time, and when the patient adapted to the new occlusion, some of the lower fillings replaced by zircon crowns. Eventually, the patient was comfortable and satisfied with the result, and so am I.